Welcome to Inside Aesthetics, the world's most listened to podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, a facial aesthetic doctor, trainer and speaker with over 17 years experience.
And I'm David Siegel, an aesthetic entrepreneur and business mentor who's been working within our industry for over 2 decades. IA is a podcast aimed at educating aesthetic practitioners from around the world. The information contained within our episodes is general in nature and should not be used by the general public to make health or treatment decisions. You should seek the advice of a qualified healthcare professional in your country and have a bespoke consultation.
For our latest news, you can follow us on Instagram and TikTok, and now you can also watch our full episodes on YouTube and Spotify. All of our links are down in the show notes below. Now let's get into today's episode. Good morning, guys. We are at the Fresh Life Conference out of our normal studio, David.
Yes, but we've got our trusty editor here with us, so we actually almost brought our editing team with us, so it's very handy. Not too much change, but nice to be here. Great location.
Yeah,
fresh vibe is amazing. Like, everyone's pumped. There's just a lot of positive energy. It's a beautiful location, so yeah, happy to be here.
Yeah, so we are going to do chapter 9 of our Masterclass Series, guys. Of course, we're off location and we're going to speak to some amazing guests today. So we've got Dr. Konstantin Frank, who's here all the way from Germany, and we're going to be talking about something we've not covered before. It's a range of fillers in our masterclass. Yep. So rather than just one specific product, we're going to talk about a range of products.
Yeah, interesting, because fillers are really topical at the moment. There's a lot of discussion around usage, reduction, what's their place now. There's almost been this, universal pullback.
Yeah.
But still an awesome tool when used correctly. Like, they're not going anywhere. So I think it'd be great to dive into this and get Konstantin's perspectives.
100%. Now, if you're watching this on YouTube or Spotify, you'll get another episode with Konstantin Frank in a couple of weeks. We're not sure when that will be published, but we're going to record straight after. And we're also going to be touching on the topic of Latibo, the toxin made by Hugel Aesthetics. Yep. So watch out for that one. Now, just, I guess, a bit of a disclaimer. We're not sponsored by any pharma to do this talk. I guess as a disclaimer, David and I are working as contractors here at the event, so we're paid for this talk. But we're going to talk off-label. We're not sponsored by Big Pharma.
Yep.
And we can talk about anything we like, which is exciting.
Well, yeah, it makes the conversations more interesting because everyone wants to know all the off-label stuff.
Yeah.
So, yeah.
Absolutely. So let's introduce our special guest, Konstantin. How are you, mate?
Very well. Thank you for having me.
Yeah, no worries.
Pleasure.
Yeah.
About this podcast.
How was your flight? It's a long way from Germany.
It's fine. I mean, you go to Singapore and then Singapore,
Yep.
Sydney. The problem is you arrive in Singapore and you're already done.
Yeah.
And then it's another 8 hours. Once you're here, it's kind of forgotten.
Yeah.
You've been here for about a week or so now?
Arrived last Tuesday, yeah.
Great. And what have you been up to in Australia? Do you like it here?
Yeah, I love it. I've been to Melbourne. Didn't see much of the city, to be honest. We're just like in some live demos and out. Then Sydney for 5 days.
Great.
Loved Sydney.
What'd you do?
Work. But apart from
You're not here for a holiday.
Yeah.
I went to Rose Bay, Double Bay.
Oh, nice.
Bondi.
All the expensive parts.
It was
Yeah.
amazing. But also downtown, obviously, checked out some nice restaurants.
Yeah.
Really good food here.
Yeah, we do.
Yeah.
Better
Very
than-
lucky.
Like, the Italian restaurants here are probably better than 95% of the Italian restaurants in Europe.
Yeah.
So well done.
Yeah, no, thank you. And it's your second time here. You were here last year for another event, and yeah, so
Yes, I was here for Aesthetics 24.
Yep.
Which was also really exciting.
Yep.
But this time it was a little bit more. Last time Aesthetics was a lot back and forth from
Yep.
different cities to Sydney. Now it was a little bit longer time Sydney. I really enjoyed it.
yeah, awesome.
Cool. What's your thought of this type of event? It's a different conference.
Aesthetics or fresh?
Fresh Life. So we're at the Fresh Life in Brisbane, guys.
Yeah.
Yeah.
It's very interesting because the audience obviously is much different than the audience that we have at usual European congresses. Europe, the whole system, how minimal invasive treatment works is different.
Yeah.
In Europe, most of the countries, it's only doctors who do it.
Yeah.
Nurses are not allowed to inject.
Yeah.
This kind of implicates that the amount of minimal invasive treatment doctors perform per head is probably much smaller than in Australia, where you have like a majority of nurses injecting who only inject.
Yes.
So your typical injector in Germany would probably be something like a dermatologist or plastic surgeon or GP.
Yeah.
Obviously, the derms and plastics do a little bit more of injectables.
Yep.
But for example, a GP might have 4 or 5 patients a week.
Yeah.
So it's not a very regular treatment. It's like for many, it's a sidekick, and that comes with some issues as well, obviously. So no, I'm very excited to be here.
Actually, an interesting statistic. About I think it's like probably close to 90% of the non-surgical treatments are performed by nurses in Australia.
Yeah.
So it's huge. Yeah.
It's a very competitive market in Europe, and especially in Germany. We have something which is called a healthcare practitioner.
Yeah.
I still don't know how you get that certification. It's kind of probably different levels how you can get the certificate. They can inject HA, but they can't inject toxin unless the patient, I think, brings the toxin to the to the appointment.
Yeah.
It's a little bit fuzzy. Then obviously you have a lot of illegal stuff going on as well.
Yeah, that's a problem, isn't it? All over the place.
Yeah, I worked in Spain for 2 years in Marbella, and it's a crazy place. It's a nice place, but it's a crazy
A
place.
lot of English people there.
Yeah, I know. For the good and the bad.
Not necessarily the good ones.
Yeah.
Yeah.
But they have like at the harbor, there are like small one-room apartments where they just do lip filler for less of the price than I would actually pay for the product.
Yeah.
Wow.
So what are they using? Yeah.
So it's getting a little bit messy in Europe right now.
Yeah.
Okay. Tell people about your background, Konstantin. Where are you from and what's your sort of training?
I'm from Germany, Munich, is where I would say is my home base. I did my studies in Salzburg, which is an awesome, beautiful city.
I was there not long ago. Yeah.
It's really nice. Very good quality of life. Then I went to the University Hospital of Munich and did a 4.5-year residency in plastic surgery, and then went for 2 years to Spain. The German board didn't accredit the full time of the time in Spain, so I had to go back to Germany to now finish off my board exam, which is coming up in a couple of weeks.
Yeah.
So I'm studying a lot about nerve transfers,
Yeah. Right.
tendon transfers, free flaps, but it's nice. And we are, or I'm joining a clinic group for a new one in Germany, who has been delivering minimally invasive treatments for now. Surgeon friend from Sweden and me are gonna be in charge of the surgical department. So we're gonna focus on face surgery, breast surgery, a little bit of body surgery, but we won't consider ourselves like body contouring surgeons. So the focus definitely is face and breast, which I think makes sense because of most of my training has been face. I've been doing a fair bit of research in facial anatomy. That's probably why I ended up here. That's basically in a nutshell about me.
Yeah. So obviously surgical training, surgical background. How do you get involved in injectables? Because they're kind of very different disciplines. You don't see many plastic surgeons that do a lot of injectables, particularly in Australia.
In Germany, I would say it's a bigger share.
Yep.
How I ended up, two key moments. First key moment, first day of university, I spoke to a guy who was the boyfriend of a girl I was hitting on the first day.
Yeah, nice.
But I thought, like, he has a really cool girlfriend. He probably knows a thing or two, so I should listen to him. He was 3 years above me. He said, listen, this university is good like any other university, but what is really nice is that you can do research really early on. And so I thought, okay, research sounds good. And I went to my anatomy professor on the first lecture and asked him, can I do research with you? And he was like, first of all, who are you? Second, why? And third, when can you start?
Yeah.
That's when I started cutting into cadavers, doing dissections, looking in the courses of arteries. It kind of took off from there.
Yeah.
And then Injectables, second key moment. This is probably what I'm going to speak about, the usual portfolio today.
Yes.
Croma portfolio.
Yeah.
Sad professor of mine was then starting to travel because the pharma industry realized people don't know about anatomy. And they're like, this guy in Salzburg in Austria and his team who are doing research. So they asked him to travel around, kind of hit a limit at one point, and then Croma approached him.
Right.
And asked, can you come to our conference? And he said, no, but my colleague can come. I was, I think, a 4th or 5th year medical student. Like, it was for me beyond imagination that somebody would pay a flight for me and get me to a different city. And I arrived there, and I think they were just in utter shock because it was the biggest event for them of the year. There were like 400 doctors.
Wow.
The student shows up. I was wearing a backpack and a hoodie. And they're like, okay, we didn't expect that. While you're here, just have a go. We don't have any alternative. I was sweating bullets. I was holding tight to the podium, you know.
Yeah.
I was just like, I don't know how to do this. It was 1.5 hour session. I was like, oh, it's too much.
Yeah.
And 2 days later, the CEO of the company calls me. I was like, oh, I'm in trouble. And he was like, listen, we really loved what you were doing. Would you mind coming to the headquarters so we can show you the company? We would like to work with you. And I was like, I would love to, but I have an exam coming up. And he was like, so you're not a doctor? It's like, no, I'm not yet. It was like, we don't care. This was really good. Come to us.
Yeah, right.
I'll show you what we do. And this is probably how I ended up. So
Yeah.
Croma was basically the first company I started collaborating on medical education.
Right.
And they still consider me, which is nice.
Yeah.
So,
Fantastic.
Tell us about Croma. Like, where are they based? And it's a family owned.
Family owned.
Yeah.
Family owned by the Prince family. Then they have a strong background in ophthalmology. So in ophthalmology, you need a lot of HA, and they were the experts. And interestingly, they bought some share of Cornell, which at one point was sold to Arrogan to develop Jupiter. They bought, I hope I don't get it wrong, so we have to take this with a grain of salt, but they got some part of Cornell and integrated in their ophthalmologic portfolio, and kind of realized that the quality of the HA they're producing is like beyond any standards that need to be met for aesthetics. So they moved gradually towards aesthetics. They have the biggest manufacturing plant in Europe, 5,000 syringes a day. It's still family owned, and the people that I started working with now, 8-9 years ago, are mainly still the same people. And this is really nice because you have really good collaboration. Makes things also as a, I don't like the word QL because I think it's overused. Comes too easy. But if you kind of work with them, it makes things very easy because it's very short communication paths, and our briefings are basically 3 to 5 minutes. And you grow in a way also with the company over time. So the introduction of the toxin was a big shift for the company, obviously. Challenging, but definitely also really rewarding. And if you're kind of working with a company for that much of a time, you probably have a better view on the USPs of a product. It's different than when you just work with a product for 2 years or 3 years, but also if you get all the rheological insights, if you can speak to the R&D guy, if you can kind of have a look at the production on a regular basis, you realize what's different about the product. By different, I don't mean better. I think this is really important to point out. I think most of the HAs which are approved by the FDA and Croma fillers are, which I think is a major quality stamp or whatever you want to call it, there's still unique properties to it. I think this is beautiful that at one point you realize, okay, this product works like this. I could actually maybe use it in this indication. Other way around, sometimes you realize when you speak to the R&D team, for example, why a product works so well in a specific region.
For the listeners that are sort of tuning into this and I've got like spoiled for choice almost. There's so many HA fillers on the market, and everyone claims that their process is different, it's better. So, I mean, what would you say would be what makes Croma different from a manufacturing perspective, from a usage perspective? What are its unique selling points that people should know about?
So first of all the manufacturing is in-house. From the actual HA, which comes in fiber form, basically, to the boxing of the syringe. Everything is in one unit. The quality of the HA they get is really, really good. Many people don't know about this, but there are actually differences in where the original HA gets sourced from.
Right.
You have different grades, like Wagyu, A1, A2, A3, A4. Also, what I think they're doing really well is having the standardized production, which allows for a very small variability in the rheology. I don't think that is unique, but it still should be mentioned with now more and more fillers coming into the market. They're really good at kind of providing a clean, pure product. And by clean and pure, I don't mean like macroscopic impurities. This obviously is a no-go anyway, but they're really good at getting the BDDE out, the free BDDE out. This is something which I think we're going to discuss a lot. That's the next overfilling of HA.
Yeah.
And I think they're really, with their products, covering all the indications that you need. So if you're kind of having the portfolio, I would say in 99% of the patients, 99% of the indications can be covered. This is something what I like about the portfolio. Their rheology is a little bit different than other fillers. So this might be something you have to adjust to when you're new to the Croma portfolio. They have a very uniform particle size over the portfolio. So I mean, how do you make a gel more cohesive and strong? You increase the gel content, you increase the cross-linking, you play with the particle size. The problem with I would say a broad particle size distribution is that the gel will never be as homogeneous as when you have a narrow particle size. And that's where Croma, I think, is doing really, really well. They have a very narrow particle size over the entire portfolio. And many people think like, why should I care? Two things. First of all, the extrusion force over the portfolio is rather similar. This makes it really easy because if you inject a lot, you get used to certain extrusion forces. The problem for me starts when you're having a full face treatment. And most of the treatments we do are not based on one filler only. You want to treat different indications in one go. So if there's a strong difference in how much you actually have to push and press, this can come from my point of view at the cost of precision. Perfect example, when I started using polynucleotides, I wasn't aware that it's basic to water. I tried it on one of my nurses and she was really excited, and I just wanted to give it a little go, and it was like probably 0.5 ml in her cheek. I was like, she was like, all right, am I okay? I was like, yeah, it's fine. I mean,
Strong massage.
glowing cheek afterwards.
Yeah.
But this is, I think, very unique about the portfolio.
It's a big thing as well. I mean, from just a repetitive strain injury, I know a lot of practitioners who've been injecting for many years, and they develop problems with their thumb to the point where some of them can't work anymore or have to be getting physical therapy because of that extrusion force.
So in my training, I obviously also had to do hand surgery.
Yeah.
My dad is a hand surgeon. He's also doing a lot of CMC arthritis.
Yep.
And actually, I have many colleagues that are referred to him because they, after years, get issues in the CMC joint, especially if you have a gel with what I would call has a high G prime. It's not the only denominator which kind of influences your extrusion force, but if there's a lot of pressure on the CMC joint, it can cause issues for the practitioner. So I think this is a really smart move of them to kind of unify it. At the same time, what the fillers are really good at is that they have a really high tau. Tau is a rather new rheological measurement parameter, which kind of tells us how much of a shear force and pressure can be applied to the filler without having a permanent deformation.
Shear force is like a twisting force.
Twisting, but also pressure.
Yeah.
So it's like a compound measurement. And I realized that this is probably the measurement we need to determine filler migration.
And is there any correlation between extrusion force and VOs?
I don't think so.
No? Okay.
I've thought about that before. I definitely can't prove it, so the listeners don't take away this that I'm saying it's true. But I've used many different ranges because as a KOL, you get given stuff to try and see how you like it, and some of them are like concrete, like really quite difficult to get in. And no wonder that people are getting these RSI injuries. But you kind of think you've got less control if all you're thinking about is force to get the filler in. So maybe intuitively, there's a problem there. But I can't prove that.
I think there's a much higher correlation with like where people inject.
Yeah, okay.
I.e. labella nose. But maybe you have a point, because this is what I said comes at the cost of precision.
Yeah.
There's no point in aspirating if you have to apply that much force afterwards. It's just going to slide on the bone.
Well, yeah.
You sometimes see it on the stage with some products, like people are struggling to get it in, and they're
shaking.
Like, it's like, shouldn't be like that.
Well, you're thinking more about that than actually where you're going, and so maybe indirectly.
Yeah.
You and I had a coffee last week, and we were talking about sometimes we use the thinner eminence of our thumb, because if you're using your actual thumb constantly, even with the best of products, you're going to get fatigue and difficulty. So just thinking about how to make your life easier might be a better long-term strategy, regardless of product.
And this is coming from racing, actually, car racing.
You're a car racer?
Unfortunately not.
We'll be doing this podcast if it was.
Define racer.
Yeah.
But I'm going on the racetrack. But what is important is that you have much more precision over distance than over force. And if you look at all the for example, in Germany with the GT3 Porsche Race Cup, the brakes don't work by force, but by distance.
Right.
Because this is how you get more precision.
Yeah.
This is how we're wired. And I think a low extrusion force kind of plays into this idea. You're preciser if you work over distance.
Yeah.
And then over force. Are you car guys?
No,
sorry?
not
I am. Yeah.
German ones?
I love German cars, yeah. You can't beat the Germans in engineering. The Italians have got great design.
Yeah, but it's not the same.
It's not the same. That's why Lamborghinis are great. The Italian design, German engineering, isn't that like the perfect?
I think it's a sweet spot, yeah. I would still go for the Porsche, but yeah.
Hey guys, sorry to interrupt your podcast. Just a quick message about our Patreon and how you can support us as a podcast. So David, what is Patreon?
So Patreon is an on-demand subscription service that allows you to access our global community of practitioners, business owners, and essentially it's a place where you can come together, get positive support, advice. Whether you're a beginner or an experienced KOL, there is a place for everybody.
Yeah, so if you download the Patreon app, search for Inside Aesthetics, there are two main options to subscribe. You can become a free member where we can communicate with you, share our news, involve you in competitions, etc. Or you can become a full subscriber for 50 Australian dollars a month. And there you get access to the WhatsApp community where people are sharing and getting advice. But also within the Patreon app, David does a lot of business coaching and mentoring. So I think you've drilled down to various topics that have cropped up that have been communicated in our WhatsApp group.
I mean, just today we recorded some content. It's quite a nuanced space, and the challenges that business owners and practitioners come up against in this space is quite difficult to get advice on. So always happy to share my knowledge and all of my mistakes and lessons learned along the way.
And then I, of course, tackle injectable content. I often involve patients or talk about new products, anatomy, and all that good stuff. So if you like what we do, consider subscribing to our Patreon. Now let's get back into the podcast. Now, you mentioned the manufacturing plant. Have you been there?
Yeah.
Have you walked around?
You can actually visit. You can actually visit as a physician if you're
All right.
if you're using the Croma products. If you're a good customer, probably I don't think you
Sure, you can't
seriously
walk
go in. But they do those tours. So by now we actually kind of decided that the anatomy courses we're doing are kind of having also a tour to the manufacturing plant. The managing R&D person is actually having a 1 hour talk with them.
That's cool.
There's a little HA lab for the doctors, and you see everything how it is produced, and it's pretty impressive.
Yeah.
Like Croma is Austrian, but even as a German, I'm kind of amazed by the engineering that goes into it.
Yeah.
It's quite fascinating. It's 5,000 syringes an hour.
That's awesome.
Whoa, shit.
It's a lot.
Yeah. I went to the Allergan one in Prongy in France. I imagine it's the same. Even as an experienced injector, I think to just go and see what happens, you're like, holy shit, this is pretty.
Yeah, and where it
crazy.
comes from, and it makes you understand the rheology much better. Like the process of dialysis never made sense, because dialysis for me,
It's like kidneys.
Clinical, yeah. It's just like this horrible. I had to spend 6 months on the ICU in my training as well, and it was an ICU run by anesthesiologists. So obviously, I was as a surgeon the ugly duckling, and they made me build those dialysis machines all the time because you have to change them every 24, 36 hours. I already forgot about it. And this was dialysis for me. It was like, what does it mean for a fitter? But what it actually means matters to us, because by the dialysis you get out the BDDE.
Yeah.
And that's what you want to have out. And is BDDE a big discussion?
I was going to say, can you comment on that? Because for a lot of people, they've heard the term, they know it's in the fillet, but it's a bit of a mystery.
There are two ways to explain it. I like pasta a lot, like noodles. You can either go in the direction, say the BDDE is kind of the sauce that makes them stick together. I prefer glue. The BDDE is what is actually giving you the cross-linking. So when you speak about a degree of cross-linking, it's somewhere between 0, in some products up to 8%. It means how many cross-linking elements are over a course of 100 disaccharides. The BDDE is actually the glue, what makes it stick together. The more BDDE you use, obviously, the more of a stronger connection between the individual HA chains you get. Many people think, if I use more BDDE, it's kind of increasing the longevity because the hyaluronidase is going to have a harder time to kind of break the strands. That's only partially true. It doesn't go to the BDDE. This is where many people go wrong. The hyaluronidase, the one we inject, but also the endogenous one, goes to the HA chain itself.
Yeah.
What happens when you have a lot of BDDE, let's say up to cross-linking degree of 2.5%, it becomes more of a spherical particle arrangement. And this kind of obviously protects the HA, which is inside from the endogenous hyaluronidase.
Yeah.
Problem with BDDE is that it is having, now, I'm not a biochemist, but there are certain reactive groups at the end of the BDDE molecule, and they are reactive. They need to be reactive in order to kind of stick together the HA chains. And due to this reactiveness, it has been shown that BDDE, it was in a rat model with an intrathecal injection, but it can be cytotoxic. This is why the FDA imposes a max limit of how many ml you can inject into a person's face or body over a year. This is why we need to be careful of how much BDDE is actually in the product. The most important thing is how little of BDDE you have, which is free.
Right.
So you don't want any excess BDDE, and this is actually a process which kind of requires a deep insight into how to treat the HA gel. And I think this plays very beautifully with this idea of this ophthalmologic background of Croma, of like probably by now 50 years of experience in manufacturing HA.
Right.
There are different fillers now on the market which claim to not use BDDE, which are pegylated fillers, for example. Personally, I've never used them for the simple reason that they still have a reactive group, and it's not the BDDE itself that's the problem, but the reactive group.
Yeah.
So if you just kind of swap that, for me, doesn't justify the claim of being more safe.
Yeah.
There are some fillers out there, and Croma is also doing heavy R&D on this, on doing BDDE-free cross-linking. First phase 2 trials actually have been done, so there's something on the horizon about that. But in different companies, we're not there yet, and it needs to be proven clinically if it actually makes sense. So this is still out to the jury.
But do you think, do you think, despite the theory of all of that, we've never proven that there's a problem with the BDDE? It's just theoretical, right?
Yeah.
There was a story, I don't know, a year or two ago, we discussed it briefly on one of our What's Trending episodes, where I think a Plastic Surgical Society implied, without any proof, that do fillers cause cancer? I don't know if you saw that. Sort of, it was a talk, not a
Fortunately
paper.
not.
Yeah, all right, but you'd see it. We would see this. Millions and millions of people have had dermal fillers from all brands, and so I just wonder whether we're sort of worrying about something that's not really real.
Well,
You have a point there. We didn't worry about the coding of implants up to the point where it became a problem. So
Correct. You don't want to be blasé.
Exactly. I think you need to have it on your watch list, but I wouldn't over exaggerate it. And I think we're kind of treating HA not fairly in recent times, for the simple reason that we ask it to do much. It's still the best biocompatible stuff we have at our hands. But if you try to make it lift, it's going to have a hard time. It's a volumizer.
Yeah.
Let's be honest about that.
user error.
Yeah, it's a user error.
Yeah.
And it makes you actually really humble when you go to the Croma manufacturing plant, because you realize that probably most of the complications you're causing, it's on you.
Yeah, everyone's very quick to blame the product.
Yeah.
When something goes wrong with everything, toxins.
This is my talk today at 12:30. Come.
Yeah.
I'm summarizing all of it.
Yeah.
It's
So can we just sort of summarize? So you're saying that in simple terms, what are the theoretical issues with BDE? Harder to
theoretical
do. Yeah.
issues that in rat models it has been shown to be cytotoxic,
Right.
but not causing cancer. That's a very important difference. Just because cytotoxic means it's killing the cells.
And that is free BDDE.
Exactly.
Not the stuff that's already cross-linked.
Yes, in very high free dosages injected into some poor mouse or rat or whatever. I think it needs to be on the watch list. To summarize, I don't think it should be our main concern. I think our main concern is how we use HA.
And does it have any implications to using like a hyaluronidase or not?
Not really.
No. Okay.
Because it doesn't go to the BDD. It does go to the HA chain itself.
Okay.
Yeah. Going to wheel us back, I guess, to the portfolio. So Croma fillers are named different things in different parts of the world. So it's called Safer in Europe and Croma fillers here in Australia. So tell us, just help us with the nomenclature.
Yeah. Oh my God, it was an issue the last days because like I'm so trained to say Safer. And then at one point...
Is it Safer?
It is.
Boom, boom.
Yeah.
It actually has a really good adverse event. You say ranking.
Yeah. Okay.
There are now very big clinical studies out there. So initially, obviously, because we didn't have MDR in Europe, the studies were probably around 100 subjects. Now we're having studies with 300, 400 subjects. None of them reported any severe adverse events. So no granuloma formation. So I think it's on. I wouldn't say it's the safest. You can never say this. I cannot prove this, and I don't want this. This may be something I have to add. This is what I like working with Croma. Usually they don't make me play the drum too strong, because I think in our industry we often kind of misunderstand the concept of being, I'm just going to call it a QL for the sake of it. It's not my job to sell. It's my job to share my experience, to help them find the USP. And the fact that I'm speaking for them should be enough.
Yeah.
That's what I think how we should tackle the whole QL thing. But coming back to this, in Europe it's called Saypha, Saypha, yeah. And then you have Safer Rich, which is equivalent to Croma Rich in Australia, which now has been relabeled as Revitalis.
Okay.
Then there is Safer Filler, which is Croma Filler. In Europe we have Safer Lips. Then you don't have that in Australia. Then there is Safer Volume and Croma Volume, and Safer Volume plus Croma Volume plus. So it's just basically the Safer and Croma which get exchanged. Previously it was sometimes also called Princess, but they completely changed that. So that's the nomenclature. Only differences between Europe and Australia is that the syringe we actually get in Europe is very beautiful. It has it's
Aesthetically, yeah.
not only aesthetically but also in terms of like handling
Design.
and design. It has a very big bevel,
Right.
not bevel, a plunger.
Yeah.
Which for me works beautiful because I told you we spoke about it, and I think you're the same. Like we inject with the thinner a lot.
Yeah.
I like to push it that way. I just color code it, which does a huge difference on the daily base. If you're doing a full face treatment, you don't have to get up the syringe and look what's written on it, but it's just color coded. So, this makes it very easy, and actually I think adds to the safe part. It is actually, I think, the first injectable for aesthetic purposes which has been approved by the medical device regulatory.
Right. That's a European sort of.
Yeah, it's in Europe we had a lot of issues with fillers and medical products themselves.
It's hundreds.
Triggered by implants.
Right.
Breast implants. We had a big, or not only one, several big scandals about implants.
Yeah.
People were like, okay, we need to make it more traceable, and we need to have like proper strategies, risk mitigations from the manufacturers. Otherwise, you will not be able to sell your product after 2027. So, in all honesty, in Europe, this is a good thing because it will remove a lot of products which are not standing up to the quality they should have. Because also when I teach, I always tell people, listen, this is in Australia it's a drug, right?
Yeah.
In Europe it's a medical device, which is basically just a legal. Is a breast implant?
Breast implants are a device. They're a device, and I'm pretty sure fillers are a device too.
They are technically, but we essentially treat them as drugs.
They're prescribed
because there's lidocaine. That's different.
So in Europe there are medical devices, and I always tell everybody, listen, what you're injecting is a medical device. You wouldn't use a dirty implant. On a breast augmentation. So make sure that you also kind of do the proper measurements to ensure that there are not many headaches for you and your patient. And I think the beauty of minimal invasive is that you can reduce your headaches.
Yeah.
Compared to surgery, it's just more risky to do surgery.
Yeah.
That's fine. But so it allows you to have less headaches, and I think that's a beautiful thing. So make sure that all along the chain of the process, you get something safe.
You mentioned some of the guest portfolio. Just tell us how you'd like use these products from Croma Rich to Volume Plus.
It depends on the patient, and I'm going to explain to you why.
Okay.
So Croma Rich is a skin booster. It's not cross-linked HA with glycerol, which is very beautiful for hydration. Honestly speaking, I don't use it too much because I'm surgically trained, so we're a little bit more on the structural side of things. I would say the clinic I'll be joining, they have two amazing dermatologists who are taking care of the skin. In Marbella, I was very fortunate to work with Dr. Kai and his wife, Gabriela Casabona, who's literally a queen of skin quality. So I'm not a heavy skin booster user, but it's a really good product. The patients like it. The way I tell them is, I either go intradermal or sub-Q, and I tell them it's like a permanent face mask I'm putting into your face. I think this is a really nice way to explain what skin boosters do. Don't overpromise on skin quality improvement that is visible, but more like what they can feel. I think this is where skin boosters are often misunderstood. Filler is a very versatile product. It has 23 milligrams per ml with a cross-linking of up to 1%. You can use it for lips. You can use it for nasolabial folds in younger patients. You can use it sometimes even in the temples interfacial plane. Just try to kind of camouflage it a little bit. It's a very versatile product. And for me, that's beautiful because I'm not putting too much volume in most places. So if a little bit is left, you can still have those sweet spots where you can work on it. It's not going to kind of be exclusively for nasolabial fold or exclusively for lips. A little bit stronger in terms of rheologic parameters is Croma Volume, 23 milligrams per milliliter as well, but with a higher cross-link. It is as well very versatile. You can use it for the mid-face, temples, even jawline, chin, piriform space. And then there is like the heaviest one, Volume Plus, also works really well in the mid-face, temples, chin, contouring of the jawline, especially in males. If you've seen the live demo yesterday, we used a lot of Volume Plus for the jawline and the chin, piriform space. Volume you can also use for the forehead, which is probably definitely a little bit more of an expert patient, but you can use it quite nicely there. It really depends on the patient and the biomechanics.
Yeah.
I never choose a product for the indication, but I choose a product for the patient.
And do you have any tips or advice for practitioners that are potentially thinking about trying a Croma product, like anything, that's nuanced about the product that would help them, I guess, be more successful with it or get better results?
This is probably true for all products.
Yeah.
I know the anatomy really well and do a proper facial assessment. This is where most of the complications, from my point of view, aesthetic complications are coming from. You need to do a good assessment and know how your product works. So get familiar with the rheology before you start injecting it. I have to admit that I was not paying too much attention to the rheology in the beginning. It completely changed the way of how I inject. So just as an example, if I have a young patient, they have a lot of mobility around the perioral region, i.e. nasolabial folds, so there's a lot of movement. I don't want to use a filler which is too cross-linked with a too high of a G prime, for the simple reason that it will disturb the mimic. So I go for filler. Elderly patients, they have less amplitude of expression. So at the same time, we need something in most of the cases which pushes a little bit more. So I'm going to go for volume for the nasolabial fold, for example. This is what I mean about like getting successful with a portfolio. You really know the indications. One thing which I think is very beautiful about filler as well when it comes to lips is that it has in class the highest tau that we spoke about. This parameter which can be linked to filler migration. And I only later realized that this is probably the reason, apart from injection technique, why I get very little migration of my lips. So make yourself familiar with this. Approach your sales reps. If you're introduced to a new portfolio and the sales team is introducing itself, don't see it as an opportunity to get a free lunch, but really work. They know a lot. I can tell you, I've been with the Croma Australia team now for a week. They have very deep insights into the rheology, and this is where the people who are using it need to push the buttons to get this information and then integrate it.
I think, and what we're obviously going to talk about Latibo in our next discussion, and it's the same issue for toxins. I deal with a lot of practitioners around the world, helping them with their businesses and talking about, how they're integrating new products into their practices. And a lot of them potentially run into issues when they bring in a new product and they try it on their patients and they don't get the results immediately. And then there's this assumption that the product's inferior or something wrong with the product. So the question is, what advice would you have for practitioners that are like transitioning to a different product? So you spoke about, understanding your facial anatomy, doing a consult, but in terms of like how they go about, making sure they're competent with it before they, I guess, let loose and because I think a lot of issues that they don't get the result that they were expecting because they're not used to it. And then there's, they blame the product and then they sort of shy away from using it.
Even if you're experienced, don't hesitate to have somebody come to your clinic and train you. Because they will give you the little bits and pieces that you need. And this is, I think, where transitions often go wrong, that people refuse to get education from somebody who's using the product because, like, I know how to inject. Sure, you do. But do you know how to inject that product? That's the question. What also helps a lot, is my impression, is if they go to an anatomy course and just try the filler on a cadaveric specimen, see how it lifts by pushing the tissue away from the bone, not the vertical lift. That's really important. See how it integrates. See how much you can actually apply force to it without kind of breaking it. Those things. It can be a process. Doesn't mean like if before you transition to something you have to do all of this stuff. But if you want to get better with it, before you start to complain, I think it's always a good idea to try to get a little bit more education. If then you still have an issue, that's a different thing. But you need to get the experience from other people who are using it. So never refrain from having somebody coming over to your clinic.
In our chat last week, we sort of touched on the point that regardless of, we try and teach people about rheology, anatomy, all this stuff, and ultimately they're just making decision for a new toxin or a new filler on price. We know that, like, generally speaking, they change because of price. And in their mind, even though they know that the products are different, they use them the same. And then they complain that they're not getting the same result as the other one. So it's almost like a mindset problem, that they're not willing to learn about the product.
And to adapt,
Yeah, and adapt, exactly.
I think it's the same issue in Germany, probably, that people are kind of trained and wired to use HA in one way. I always compare it to wine. If I get a Sauvignon Blanc from Australia, it's not going to be the same like when I get it from South Carolina. It's going to pair different to the food. So you have to know how it tastes in order to get a nice menu going. If you're not willing to adapt to that, then that's basically on you.
Well, we use the car analogy, right? All cars pretty much work the same way, but how you're going to park them, how they're going to respond, handling. There's going to be nuances between that. And before you hop on the racetrack, you actually probably want to spend some time driving it in a controlled condition. It's probably,
Not even on the racetrack.
Yeah.
So my girlfriend got my previous car. It's one generation before what I'm driving now. And it doesn't have like those lane assists. It does, but it's much more simple. So whenever I use her car for whatever reason now, I'm just like, okay, we have to make this work, because you're so used to the car driving differently, you know?
Yeah.
Parking has become incredible for me, because I have this button and it just parks. It's so beautiful. Now when I have her car, it's like, shit, nobody's watching me.
The 20-point turn.
Yeah. 25, to be honest.
Yeah. Hey guys, sorry to interrupt the podcast, but we wanted to share a great new IA offer with you. If you're new to the podcast, IA offers are our promotions and special deals that we've negotiated just for you guys.
Today's IA offer is from Bacteriostatic Water Australia. They're a company based in Brisbane here in Australia, and they've been one of our most popular partners to date. If you buy 10 vials of bacteriostatic water or saline, you'll get an extra 5 vials for free.
This is valid on 10, 20 or 30 ml vial sizes. That's CC if you're listening in North America. And in addition, if you use the code IA10 before paying online, you'll save an extra 10% off the total price. If you're outside of Australia, this offer can easily be accessed, and shipping at most will be 30 extra Australian dollars.
To access this IA offer, please click the link in our podcast description, and the promotion ends on Monday, the 8th of October, 2025. Please check your local regulations and compliance procedures before considering using any injectable products when treating patients.
Now let's get back into the podcast. Now, honest answer, do you use anything else in your clinic, in your cupboard, apart from the Croma range? I guess my question is there anything that doesn't quite cover that you need for your patients?
Fat grafting.
Okay.
Okay, yeah.
Because that's my favorite filler. That's my favorite filler. No pharmaceutical company will ever get me to abandon fat grafting.
Yeah.
Just because it's a beautiful procedure. It's very regenerative. You'll never get that kind of regeneration, but you have to do some liposuction before, so that comes at a risk as well.
Yeah.
And this is probably where I have been wired early on. I use a different product for infraorbital hollers.
Okay.
For the simple reason that I've been trained with this product all the time. I don't like doing lower eyelids with HA. Like, my indication has become so small. The amount of patients that we're treating with HA for the infraorbital is so small, ever been. And I'm very grateful to Kai and Gabi in Marbella. Actually taught me like how to tackle the lower eyelid. Most of the time it's a surgical indication. I'm using this one product because I've always used it. I never had an issue with it. So sometimes I think it's also okay to, if you have a system that runs really well for you, you don't have to completely abandon this for the sake of staying within a portfolio, or because you're speaking for that company, you have to abandon everything else.
Yeah.
I'm using something which would be out of the portfolio in Australia, which is not in Europe, because Croma also has polynucleotides in Europe.
Yeah.
Right.
I love polynucleotides.
Yeah.
It's a very patient satisfying procedure. And then there's always a place for collagen stimulation at some points, especially in body indications. I think important is that if you choose your portfolio, that there's a certain variability as well. Don't just stick with something because you've stick all your life with it. And I think in medicine, like being trained, at least in my first university hospital in Munich, a lot of justifications were, we've always done it that way.
Yeah.
And that's the biggest killer.
Yeah. It stops progress.
Yeah.
So be flexible.
We see this with injectors all the time. I'm sure you do too. When you're mentoring, they sort of get stuck in a path, and maybe their patients are happy, which is great, but they do the same thing for 20 years. They don't evolve, and they don't move with the times, and they stop going to conferences because they think they know everything. And it's a shame, because there's new stuff coming all the time.
Yeah, totally. You should be always trying to elevate your practice and the results you get for your patients, even with things like tox. I mean, people that sort of don't see the importance of clinical reviews. Oh, they'll call me if there's a problem. It's like every time you see that patient, you should be trying to get a better result.
Elevate, by the way, is the name of our clinic.
Oh, there you go. Yeah, there you go.
Only doesn't stop at a portfolio or something. Like now joining this clinic, they have certain policies on how to approach a patient in a consultation. And for me, it was completely different of what I've been doing in the university hospital, obviously. And sometimes I was like, I don't know if that works. It works really well. So sometimes you just have to be open to change. Keep a certain flexibility and never stop learning. I mean, I go to way too many conferences, but whenever I go, I take at least one thing back home. If you go to a conference, think about 3 things you want to learn. You will not remember much more than that, but 3 things, take them home and try them.
Yeah.
That's I think really important. Also, when you switch to a new portfolio, there's a learning curve with everything.
Yeah. Totally.
Don't abandon something. So if you switch to a Croma portfolio and are not happy with your first result, it doesn't mean it's a bad filler.
Yeah.
It just basically means you haven't reached your full learning curve.
Just a couple of final questions.
Of
You spoke about your love of biostimulators as well, and we've seen globally, we sort of referenced this at the beginning of our chat, like there's been almost like a pushback, people reducing their filler volumes, and now running towards biostims as like the next thing, even though they're not new, they've been around, but we've got new products coming out. Do you have any thoughts on that?
We don't have new products, we just dilute them differently.
Yeah. There you go, right? Do you think there's a danger of us overcooking with biostims? Like,
yes,
yeah,
100%. There's a very niche indication which I think has been broadened way too much.
Yeah, okay.
One problem I feel with collagen stimulation that we have is that it's unpredictable in terms of like you never know how much it's gonna give you an increase of skin tightness, but also volumization. I had to learn this the hard way.
Yeah.
And then there is an increased risk with granuloma formation. I know there are studies out there that say it doesn't happen anymore. I can just personally say I had 2 granulomas in patients. It wasn't very pleasant, to be honest. They have a spot. They have a huge potential in body contouring.
Yeah.
Minimal invasive body contouring, because this is where I think HA isn't doing so well. But it needs to be a proper indication, and it will never be as biocompatible as HA. That's a simple fact. So I think HA is always going to be around.
Yeah.
There's no way around it.
You mentioned filler migration. What's your understanding of what that actually is? What's happening?
It's actually a very natural process that is getting too much attention.
Yeah.
From my point of view, with patients coming in, it's like my filler migrated, and it was this other person who injected, and they did, and it's like, no, this is just like what it looks like after a couple of years, probably. Whenever you inject into the face, you need to be aware that it's a highly dynamic territory that you're entering. So there's always going to be some point of what I would call passive filler migration to the filler itself. It's not the filler that decides to create a filler mustache or something. It's actually the activity of the orbicularis oris. What you need to make sure is that you use a product which allows for enough cohesivity and stability to stay more in place than other fillers.
Yeah.
That's my take on filler migration, but we're heavily exaggerating it. Many overfilled faces are now termed as filler migration in Europe, and they're not. It's just you've overfilled it, man. It's not the filler that's the issue. It's you who put way too much and then complains about it afterwards. I don't think that filler migration shouldn't be that much of an issue. Apart from lip filler injections, which like it's this Russian technique. I don't know if you have it.
Yeah.
Obviously, this is gonna go wrong because if you do so many channels, I mean, what's supposed to happen?
It's going to squeeze out the channels.
Yeah, exactly.
Yeah.
So this is where I think filler migration has its place.
Do you think that injectors on Instagram and maybe TikTok, we've only just become friends with you on Instagram, so I haven't checked your feed yet, but do you think lots of injectors have been guilty of almost amplifying these quite niche things as major problems? They're just talking about it constantly.
So my Instagram is as boring as I am. It's just some.
It's very German.
Yeah. For 2 reasons. First of all, until now, I worked, apart from when I worked in Spain, I was in the public system. So you're not supposed to do anything there, which is reasonable and fine.
Yeah.
And in Germany, we're not allowed to show before and afters.
Yeah, same.
I never
Kicked in yesterday.
Yeah.
In Australia.
which I think is a good thing, to be honest. First of all, I realized when in Spain it was allowed, I realized how much time I spent on getting the photos at the right angle, even if you use a vector system for the clinic's Instagram. So it takes a lot of time to actually get this done. Second reason, no case is like another one. So it becomes hard. I think patients should trust in different qualities. We can still show BNAs and consultations. I think this is where it has its place, because then you can choose deliberately. This fits your case more or less. But I think people are using niche problems to get exposure.
Yeah,
of course, everyone's trying to get their voice heard. Yeah,
and I don't know any other industry, at least in the medical field, that is doing this. And it's
can you imagine if you're a
very
surgeon
bothersome
talking about everyone's disasters? It just doesn't happen.
My dad is an orthopedic surgeon.
Yeah.
So from time to time, I took him to one conference. He's an old school orthopedics.
Yeah. Okay.
And he was in disbelief.
Yeah.
Because I think I went to the wrong venue. This looks like a wedding convention. It's like, no, you're right. But I spoke with him about things like fluid migration, actually.
Yeah.
Because I have to do a little bit more social media right now. And he said, listen, do you know how many problems we have with some screws or plates or stuff? Like, I don't know a single colleague who would get out there and kind of make a topic out of this
And do a dance.
And we're kind of creating our own problems right here, because we're like, in Germany, people are like, aesthetic medicine is not proper medicine. Like, yeah, take a guess why? Because you guys are dancing on the stage, and nothing against a little dance, okay? But like, how professional do you want to be seen? And do you really want to make an absolute niche problem to a big thing and influence people and patients in a way that they're getting very conscious and afraid about it? It's kind of almost a placebo. So I told you, patients coming in and saying, I have lip migration. It's like, your lip looks perfectly fine. Are you sure? And it's like, I'm pretty sure. So this idea of using something very small, making very big to get exposure is a huge problem in this industry from my point of view. I don't know if you agree.
Oh, totally. Yeah. I mean, well, it's because it's not no one goes to the orthopedic surgeon because they want to. They have an injury, they have something in their life that needs correction, right? So aesthetics is this hybrid little area of medicine which is want-based, but there's still a very serious medical component to it. But it's hyper competitive. There's a lot of glamour and, prestige, I guess, with sort of being an aesthetic practitioner. Well, I think that's the perception. And so I think it creates this, this hyper competitive space where people are looking, as you said, for an edge, to be known for something or to get do something their competitors are not doing. And it's, as you said, it's like an own goal. It's basically we're creating a rod for our own back.
Honestly, all colleagues I know that are very successful never did something like this. They created their reputation around something ethical, sustainable, and scientifically backed up. And I think this is where we have to move towards to.
I think we're going there. I mean, I think as an
100%.
Yeah, we're a very young industry. I mean, compared to like other areas of medicine, aesthetics is relatively new. I mean, plastic surgery, yes, but I mean, in terms of like non-surgical. And so I think we are getting to this more mature phase where we'll start to get more serious about what we're doing, that the people that shouldn't be in the industry will self-select and leave because it's just not a place for them anymore. The regulators are catching up. They're, clamping down on how we advertise, before and after photos. So I think over the next 5 to 10 years, I think we will start to settle down and become a lot more serious and respected as an industry.
100% with you. And I honestly think that if you look at it like in Europe, they kind of put the manufacturers in a really hard spot.
Yeah.
Having to deliver phase 3 studies, which cost millions of euros to show the efficacy, longevity, safety of their products. At the same time, this didn't happen on the physician side of things. So it's like, you have one eye and 2 fingers, you're good to go. And I think it's going to kind of move up to the standard. And I think it makes sense. So we need to invest into education. Everybody needs to. We need to invest in sustainable education. That's a different topic.
Yeah.
This is what I think also companies need to invest into something sustainable and structured.
Yeah.
And then I think it will, as you said, there's going to be a certain natural selection by itself.
Yeah, final question. So I guess, do you have any predictions about HA filler use? Is it here to stay?
It'll go up.
It's going to go up again. I mean, did you guys see in Europe, in the last year or two, because of, cost of living crisis, etc.
Yeah.
Patients were pushing back on price and their spend in their clinic?
Definitely a certain kind of reduction.
Yeah.
But it's going to be around forever. And it's going to swing. It's a pendulum. It's like breast implants, texture.
Like fashion.
Yeah, it's like fashion. Look at the trousers.
Yeah.
It's the same thing.
And haircuts, the mullets back. If you only have mullets in...
Yeah, I was advised to get one because...
But you've got the cool, trendy European one.
I don't know. But it's kind of moving back. That's okay.
Yeah.
That's okay. I'm just going to go with your hairstyle.
Yeah, it's much easier. Yeah.
So.
You save a lot of money on shampoo and hair product as well. So.
And what do you think about the cost of the Croma
I used my
range?
girlfriend's one, so I don't...
Oh, yeah.
Yeah, can you comment on cost? Like, where does Croma sit in terms of value for money, I guess?
I think it's reasonably priced. I actually think they could be a little bit more expensive. But we're in a price-sensitive
market.
So I think they position themselves just right. I feel many fillers are overpriced for what they deliver. Now that's the question: what's overpriced, right? Or are the others one a little bit too cheap for what they actually deliver? That's like probably a point of view. Reputation-wise, we've seen a great increase in reputation for Croma fillers in Europe in the last years. I've got the message that it was also the case in Australia, and I think it deserves that. It really does. I think for a company, it's super hard to find the sweet spot of offering a product which is affordable enough, yet kind of not coming over as a low-cost product, because you don't want to have a low-cost product. So this is, but then again, everybody wants to save money. It's
hard.
really hard.
Yeah.
It's really hard. And I think they're doing well in terms of positioning.
Yeah. I mean, in the States, our listeners in the States, they would always complain that their cost price is way higher than Europe. Australia, we've been traditionally quite high compared to Europe as well. So, but I think Croma was seen as certainly more affordable, but not cheap. Let's not confuse the words.
If you go to China, your mind will be blown.
Right. In what way?
$1,000 a syringe.
Wow, $1,000, like €1,000? Oh, okay.
€1,000.
Whoa.
Syringe.
But I would say, I don't know if you've been to teach in China, they're almost at they're where we were 10 years ago. They're just starting to sort of become more normalized. It's obviously popular, but still quite micro niche. And they need more injectors. They haven't got enough trainers to teach enough people.
It's increasing, let's put it that way. I was last year for 2 weeks in China. I was mind blown.
Yeah, right.
The clinics, oof.
Yeah.
We're in trouble.
Yeah.
We're really in trouble because they set the standard so high. Because you spoke about education, I failed miserably in my first 2 talks. Why? Because I tried to educate them how I inject, but I have a Western beauty ideal.
Yeah.
They don't have a Western beauty ideal anymore. They have a Chinese beauty ideal. Probably one of the most extreme things is that they put filler behind their ear to make them stick out.
Yes.
Like, we actually make money in Europe by putting them back.
Yeah, right.
Yeah.
We do the reverse. It's linked to status. Filler is expensive, so if you can push your ears out, first of all, it's going to make your face look a little bit slimmer, like it's an optical illusion. Second thing, if they stick out, that's a little Birkin behind your ears right there.
Yes.
So it's like a status symbol. But I think we're gonna learn from the Chinese doctors in a couple of years.
Yeah, I think so. And there'll be a lot of innovation as well, new products.
They do. They have a lot of crazy good products coming up.
Yeah, right.
The China FDA is actually really strict, so they make sure that there's nothing weird coming into the country. At the same time, nothing weird coming out of the country. It's definitely an exciting market. We should, from my point of view, put much more focus on than the US market. It's much more innovative. Also, how they run clinics.
Yeah, right.
I learned a lot about running clinics
that's interesting.
in China.
We should have a chat about that. Interesting.
Yeah. Now, to bookend this one before we get into your next episode, what's your favorite toxin and why are you using it?
Tivo.
Lativo. Okay. Well, actually, before we get into Lativo, we'll save that for the episode. But what's the relationship between Hugel and Croma?
They have a joint venture, which is a little bit probably more than a joint venture. So I'm like not in the business books of Croma, so I honestly don't know everything about it. The way it works in Europe, I can tell you, is that Croma is selling the Lativo toxin,
Right.
which is obviously produced in South Korea by Hugel. Then there seem to be joint ventures around the world. Like, for example, in Australia, they're selling the Hugel, selling the Lativo, but also selling the Croma filler. So it's a joint venture, I would say. And I think it makes very much sense because having a complete portfolio, I usually only work with companies that have a toxin in their portfolio.
Yeah.
For the simple reason that the pharmacovigilance is just completely different. They have a different understanding of how studies work, how they need to treat the product as well. So that's basically the story of the joint venture between Croma and Hugel. For me, it was super interesting because I got to work with Croma for a really long time. Then suddenly I got this South Korean stepdad or whatever you want to call it. And I've learned a lot by this. This is actually a really beautiful thing. I'm much more in Asia than before. And as I said, you always learn something. In Australia, I learned that you can use toxin actually for hay fever.
Yeah, hay tox.
Well, that's been a bit controversial, but very off-label. Some people have got some interesting thoughts about that. Someone last night actually asked if we can do an episode on that particularly.
Oh, right.
But both obviously technique, but also potential risks and problems and
There you go.
data. So yeah, maybe we'll do that for you guys.
Yeah.
Yeah,
Let's
we'll
do
get you back when you've tried it.
N0 for now. Maybe next year N15. We'll see. But I'm going to try it. Makes sense. I'm going to try it on my own first.
Yeah, especially springtime.
Thank you for joining us, Konstantin. It's been
Yeah,
a real
thank
pleasure
you.
to catch up with you. Like I said
Likewise.
to the listeners, we'll be doing another episode soon with Konstantin on the product called Latibo, which is a toxin. So look out for that one in the next month. Any parting comments, David?
No, great. Again, love doing in-person chat. It's been a little while, so good to have someone physically here chatting to us, and lovely to meet you, and thanks for your time.
Likewise. Thank you for having me, inviting me.
We hope you enjoyed that episode, guys. To stay up to date with our latest news and episodes, follow us on Instagram, and we're now on TikTok.
You can also now watch our full video episodes on YouTube and Spotify. So if you like what we do, please give us a like and subscribe. Please also consider joining our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, hints and tips videos, bonus podcast content, and more. All of our social links, Patreon, and contact information are in the show notes below, and we'll see you in the next episode.